we also measured some aspects of the cost benefits in terms of medication, admissions to hospital, attendances at hospital, attendances with the GP, all the kind of ways in which cost accrues around people with very complex problems. And that study that became a very large study, and it gave us a good understanding of the benefits of having a psychological intervention with this group of people.
Yes.
So
Yeah.
some very significant savings and some very significant benefits in health improvement. And that was sustained at 4 years post treatment, which is there's quite a long follow-up, really. So and we're doing...
Keep going, sorry.
Yeah, well, one of the things you mentioned there was using research to change GPs and doctors. And, you know, one of the things that has always amazed me is that doctors generally, they recognize these things. And I did a little bit of research around why doctors don't refer for psychotherapy and don't think about doing introducing psychological interventions. And there were two findings from that. One was just a general resource issue. They were really despondent about finding clinicians who could work with people with these complex somatic, psychological presentations. And some were really, they were really burnt out with trying to find ways of helping people. And my thing is, if I was to try and change the system in any way, I'd change the approach of psychotherapists, because most psychotherapists don't recognize the link between body and mind in quite the same way.
They don't.
I think if we turned up with a good bunch of clinicians who knew what they were doing with these disorders, GPs would fall over themselves to refer people.
Yes.
So I think it's our own world. It's my world that needs to change. My world of psychotherapists that needs to change to put themselves in a better position to provide treatment for people like this.
That is so true. Yeah.
Yeah, I think that's true.
Yes. Well, it wasn't until when I saw All the Rage, that movie, and sponsored it here in Melbourne, that was when I thought, oh, so this work that I do, when people would come to see me about a relationship problem, and then they'd tell me their pain had gone, it sort of flipped my way of seeing it as well. That people could come about their pain and go to their relationship problem, and both of them get solved. Yeah.
It is fascinating how you can start off talking to somebody about a relationship and you end up talking about physical pain and the relief or what can happen with the physical, and vice versa. People come with physical pain and talk about a relationship. And I think I find that kind of thing fascinating, really.
It is.
And
it's awesome, actually, to think that there is a way out. Now, the other question I've got: did you have to go to Montreal to do this training? Are you an early sort of pioneer of this work in the UK?
Okay, so in terms of ISTDP, I started my training in short-term psychodynamic psychotherapy with David Mallon in the late 1970s. Yeah, late 1970s, at about the time that David Mallon met Davenlew, and Davenlew came across to the UK, and he was quite a frequent visitor to the UK in his partnership with Mallon at that time, and a number of us started a training for ourselves, a training group for ourselves, in the early 1980s. Which became the bedrock of this. It was essentially a core training, but it was a training group that we were all people who'd been in some sort of training or supervision with David Mallon. And we were introduced to the Davenlew's, the model that Mallon and Davenlew developed. And some of that group went off to, I was in my 30s, so with small children coming along, so I wasn't up to doing a lot of traveling in those days. It was a lot more difficult than it is now. But several of our group, I was the baby of the group, actually. I was 10 years younger than anybody else in the group at that time. And most were experienced psychoanalysts and psychotherapists, and some of those people went off to train in Montreal and in Switzerland, of course, where Davenlu did a lot of training.
Oh, okay. So that's the source of the Swiss group. Because when I was in Montreal, there were a lot of Swiss psychiatrists in Davenlu's group there that I met.
Yeah.
Tell us a little bit now about how anxiety and self-criticism and that operates, and why it's so very, very hard to break it for patients.
Okay, so this is a complicated one, and most of this work psychologically for us as clinicians and researchers, this is quite a complex thing to unpick. What we know is that many of the patients who come to us have they experience a lot of self-criticism and a lot of a sense that they're being criticized by other people. We also know that a lot of the people who come to us have a sense of neglect in their lives at some point or other, one way or another. And how we understand that is really important when we're working with people with these kinds of disorders. And I think Rose mentioned to me when we first started on this invitation to bring me along here, which seems quite a long time ago now, Rose, I don't know. So,
it was months ago.
But she mentioned intrapsychic or psychological conflict as well, intrapsychic conflict or psychological conflict, the way we end up with being torn in two directions within our minds about the things that we face. And I think that's tied up with the whole issue of criticism and neglect. And I'll just try and put that together for you, if you like. You see, one of the ways I always try and understand an adult is where the adult has come from in their early life. And then I think generally, I think about the infant in those early years of life. And an infant who is 0 to 3 months old is in a world of its own, right? It doesn't understand that there's a big world out there. It understands itself and its primary caregiver. And I'm going to talk about mother or mummy or something, probably could be daddy or granny or whatever, but I'll talk about mummy. And the infant interacts with mummy. So when the infant is lying on the kitchen floor on a mat and is gurgling away to itself, it has a mobile hovering over the top of it, and mummy's got a marigold gloves on and she's in the kitchen sink doing the washing up. The baby starts to cry. Mummy whacks off her rubber gloves, goes over, picks up the baby and says, now, darling, I've only just fed you. And she wins the baby and puts it back down. The baby gurgles away and gets on with its mobile. She's got a marigold gloves on, and she finishes the washing up and gets on with a few more jobs before the baby needs more attention. Right now, this is a good interaction between a mother and a baby. Now, when the baby's 9 months, 6, 9 months, 12 months old, the baby's on the rug again. It's got toys scattered around it on the floor and it's throwing them about and chewing them and doing whatever else the baby does. Mummy's got her rubber gloves on in the kitchen sink. And she's washing up, and the baby starts to cry. And mummy says, "Oh, well, I've only just fed you. I don't know what's wrong with you now. Just give me a minute while I finish the washing up." Right? So then she finishes the washing up, and the baby cries for a little bit and gives up and cries for a little bit. And when she goes over, she picks up the baby and she says, "Oh, you've got a dirty nappy. I better change your nappy." Now, the significant change in those interactions is that when the baby's younger and is less well formed within itself, the baby gets immediate attention. It doesn't tolerate frustration very well, and it doesn't tolerate the separation from the mother very well. When the baby gets older, then frustration is much easier to cope with for the child. And in fact, it's very important. We call it optimal frustration, right? And that difference is about the building within the child of a sense of self and the resilience to deal with the problems and the adversity of the world. A lot of patients come along and they think, well, we'd love there to be a world without adversity. I get depressed because I face adversity. And my first conversation with a patient is, no, the world is full of adversity. It's how we deal with adversity that's the problem, right? And how a child, an individual learns to deal with adversity starts in that first year of life, with how it can tolerate frustration, it can tolerate separation from the mother, and it's got the resources to manage that. Now, some people grow up and they find themselves with some limited resources. And neglect, for instance, and that can take on many forms. I was dealing with somebody a month or so ago whose mother died before they were 1 year old. And that person has a terrible sense of neglect inside themselves, a sense of missing out on things, which has shattered her life in many ways. And she finds it really hard to tolerate an absence in her life. And part of our work now is starting to build some resilience to be able to tolerate some distance, but also to manage the neglect. But patients who have some form of neglect in their life also become self-neglectors. And they don't look after themselves well. And neglect and self-neglect go together as a dyad, right? So people tend to repeat those patterns. So people who've had neglect early in life tend to find themselves in neglect later in life, and they neglect themselves. And people who neglect themselves end up with physical illnesses, right? Poor diet, not looking after yourself properly, lack of exercise, all the things, putting ourselves in positions where our health might suffer, very common thing to do. But on the back of that, a child of 1 year old, 2 years old, 3 years old, and older who experiences criticism in their lives also ends up experiencing themselves as critical of themselves, right? So they develop a system in which they're wrong all the time because they've been thought they were wrong earlier on. So the infant that's got neglect believes that they're a bad person. They don't believe that they deserve looking after. Yeah, this happened for a reason because I'm a bad person. Or they might think that I get criticized because I really am a bad person. Right? I've done really bad things and I deserve criticism. But these are quite destructive processes and they drive anxiety. The point is these things drive anxiety. These are the kind of conflicts that people are faced with. So I might think to myself, well, I can't confront my partner about the fact that they're not doing the washing up or they're not doing much around the house, because if I criticize them, they might leave me. Yeah. Right? This is a common scenario, right? But that leaves me with a terrible anxiety inside. I have a frustration. I'm frustrated with the situation that's arising in front of me. But if I try and tackle it, I may actually lose the person who I need in my life because I can't live without somebody. Right? So these are terrible conflicts that people live with, and they drive enormous amounts of anxiety for people.
They do. So they have mixed feelings, don't they?
Well, that's exactly right. There's mixed feelings towards this partner who's not doing stuff around the house, right? Yeah. They frustrate this person, and this person feels angry and enraged by what's happening, right? But they also feel they also need them. There's an attachment to this person, which we might call love, right? Yeah. And they have positive feelings towards this person because they're dependent on them. There's a dependency between the two of them. Yeah. And if I get angry, am I going to lose this person? And am I going to end up feeling neglected and lost? So this is a terrible set of conflicts to be stuck in. Yeah.
Could you expand?
Does this make sense, Rose? Am
Absolutely.
I talking?
But would you also expand now into guilt? about having those complex feelings, because that's one of the unseen thing that happens with people, isn't it? They've got complex feelings about their, the interaction with their loved ones, but then there's this guilt going on as well.
Yeah.
Can you talk a little bit about that as
well?
well?
Guilt is part of the conflict, isn't it?
Yeah,
The guilt is, if I'm enraged, I might damage the other person, or I might damage the relationship with another person. So if I'm enraged by a person who isn't doing the house, helping me with the housework, doing the washing up when it needs doing, and if I express my anger or my rage or my dissatisfaction with this, I'm going to find myself criticized and feeling that I've damaged something in this relationship. So shame is when I feel I'm a bad person. It comes from a sense of neglect, that I'm a bad person. And where criticism is the primary trauma, then it's the sense I've done bad things, right? And bad things might be having angry feelings.
That's right.
Doing damaging things to people, right? So the difference between feeling you're a bad person and feeling that you've done bad things or can do bad things, that's the difference between in developmental terms. So and it's the different, and both of those drive anxiety, right? So the sense that there's a judge around, or a critic all the time, that's going to bring me to heel for the bad things that I've done, it causes tremendous anxiety, right? I use the court scenario a lot in my work, right? It's easy to pick up when people are being self-critical, and it's easy to pick up when they're finding themselves criticized by other people, think they're going to be criticized by other people. But when you start to introduce the fact that there's a judge around with a set of rules and laws, and the judge convicts them of a crime and initiates a punishment, then people start to grasp this in their minds in a way that it's possible to work with. Yes. And so that rage and anger or disgust or whatever the emotions are that somebody's experiencing inside can come to the surface into a conscious world without there being guilt. Right. So
would you expand again, because you brought up a wonderful concept, and that is, why is it that people see anger as being such a bad thing, whereas in actual fact it's a feeling within you?
It's a normal human emotion, right?
Yeah.
But people believe that it's going to be damaging, right? And that's particularly true if I have a tenuous relationship with my partner, and neglect and loss from the early stage of development that I've talked about with the child and the mother. If neglect and self-neglect are a problem, laying there in wait for me, to an attachment failure effectively, then to express some dissatisfaction towards my partner, some rage or some anger, might lead to the destruction of the relationship, right? And so then there's that sense that I can do bad things which then have a detriment to me. Yes. So these are really problematic cycles of guilt, right? And that arise here.
But when a person is angry, they actually don't have to do anything about it, do they? Except that they can feel it within themselves. Like often people will think,
feel it with
someone.
Absolutely, absolutely. Yeah, but it's important to know that it's very easy to get into cycles of repression where we hide away the things that we don't feel good about, right? Yeah. If I feel like I'm a bad person, I hide it away. I don't want to show people I'm a bad person. If I think I do bad things, have anger or whatever, then I hide it away. And hiding it away, repressing it inside ourselves, and not dealing with the anxiety that it produces, leads to these kind of symptoms that we've been talking about earlier on, right? how people can overcome the repression and the sense that they've done bad things and can do bad things with their anger is really part of therapy. And that's the experience that somebody can have with me as a therapist, with you as a therapist. Can a person allow themselves to feel their anger, to actually experience their anger in a normal and natural way, and for nothing bad to happen from that, right? So that it.
Could you go back in that moment now about how when a little one, a child, is angry and they're sent to their room, and that's sort of, or they're punished in some way for being angry about something that's hurt them? Because don't we only experience anger when we've been hurt?
Yes, I'm not. I think we feel anger when we're not getting what we want, right?
Yeah.
So and or we're getting what we don't want. So it can. There's a coin here. It's either what we're getting what we don't want, or we're not getting what we want, and that leads to frustration. Somebody's frustrating us, like the mother frustrates that child by keeping her rubber gloves on, finishing the washing up. The child feels frustration. With the child experiences the mother as frustrating, and will feel anger towards the mother. Okay, and it's how that can be whether that baby will grow up to have the resources to tolerate the anger in the relationship and feel secure with it. Right?
Perfect. Yes, you've actually that's the core of it, really, isn't it? To allow yourself to be angry without actually displaying it as an adult, I'm talking about, but also hold loving feelings.
Yeah, absolutely.
Yeah.
Yes, yeah. I can experience the mother as being loving while also experience anger towards her because at times she frustrates me.
Yeah. And then, of course, it comes out in relationships, and the person who's got the somatic pain is repressed with their feelings, and the pain actually is sort of like a pressure cooker, isn't it? And like everything's repressed, and then it blows its steam off as pain, doesn't it?
Well, the anxiety part, I mean, the point about anxiety is that it's a fear system, right? And we fear our anger, right? That's why we are anxious, is because we fear it. Our normal fear system becomes aroused, and it's one of the ways in which we might experience chronic anxiety. Well, chronic anxiety will lead to pain. It's an energy. It's an arousal of a bodily system with hormonal and neurological consequences, and that energy has to dissipate somewhere or other. It doesn't. The body is powering itself up for action, right? The fear system says, I'm going to need to flee from here, or I'm going to need to fight, and it's all this energy to do something. That's what the anxiety is. It's the adrenaline, the cortisol system, right? We're generating anxiety, but as individuals, we can. It's a bit like a car spinning its wheels. The tires get really hot and smoke, right? Not good for the car to do that. Well, that's what happens to individuals. They come to see me and they say, well, I'm very anxious and it's causing me a lot of pain and distress, and I actually get physical symptoms with this. So I say, but you're sitting there, your fear system's aroused and you're spinning your wheels, and is it any wonder that there's smoke coming out of your ears, right? Then the issue is, why is your fear system aroused, right?
Yes. Yeah.
And then it's, why are you judging yourself? Why does anger cause you to be anxious, right? So that you hide it. These are the really important questions that we can engage with people on, that can change their lives, right? This can change your life if you start to see this as a perfectly normal reaction to a lot of energy being generated in your body because you're frightened of something, right? Yeah. This is really important stuff.
Yeah. And once it's seen, it's never unseen. I don't know where that saying comes from, but it's so...
that's Freud. Yeah.
Yeah.
He said you can't put it back in the box once it's
Exactly.
out.
Once you've spotted it, there's no going back, is there?
Yeah, that's right.
Yeah.
And what you're giving people is threads that they can find their way more into more knowledge.
Exactly.
This is why mentalization is so important, right? Mentalization, and it counters neglect. If you're starting to observe yourself and you observe that anger causes you to be anxious, then that's a counter to neglect. You're starting to pay yourself attention. And if you start to pay yourself attention and you think about what you can do about that, you're really countering the neglect and the self-neglect.
Okay.
Right.
Now,
and self-neglect leads to people being chronically spinning their wheels rather than saying, what is this that's causing me to be anxious? Right.
Yeah, that's the question, isn't it? Always.
Yeah. But once people start to get curious about this, then it's countering the neglect, and it's also countering the potential for criticism. Because if I can say, well, maybe I'm angry and that's okay, even without feeling it, they're starting to counter the judge, right? They're starting to stand in front of the judge and say, actually, I'm not guilty. I don't need to feel guilty about this. Yeah. So we're leading people to a path where they can start to stand in front of the judge and say, not guilty, Your Honor, right? So these are all important processes in therapy.
They are. Yeah. Could you also mention a little bit about the fact that mentalization doesn't always come easy for some people, and it's usually, isn't it, connected to early neglect? So
it's because mentalization invites you to hold your mind in mind and the mind of the other too, but that assumes that you have a pathway to not neglect yourself. So mentalization counters neglect and self-neglect, right? That's why it's hard for people. Well, one reason it's hard for people is that it counters that very early neglect. If I've learned to neglect myself, why should I pay attention to myself? So why should I mentalize? And if I mentalize, all I'm going to find is I'm a bad person, or I'm a guilty. I'm just going to find more guilt, right? So I don't want to mentalize. I don't want to look into my mind because it just causes me more pain. Right? This is the person with the broken leg, right?
Yes.
They don't particularly want to pay attention to. They don't want to pay attention to their own leg, and they don't want anybody else to poke around their leg because it's going to hurt, right? I had some abdominal pain a couple of years ago, and I had to go to the doctor, and I just knew he was going to palpate my abdomen, and I knew it was going to hurt. So I put off going to the doctor for about a week because I could feel how tender it was myself. But I just knew the doctor was going to put his hands on my abdomen and give me a big prod. And and that's what it's like, isn't it? If you've got an injury inside yourself, an emotional injury or something that's emotionally sensitive, painful, then do you really want people rooting around in it? This is a terrible conflict for people who come to therapy,
Yes.
Yeah.
And, would you also talk about in psychotherapy how the need to sort of scaffold the person to be able to tolerate that suffering? Because isn't that what it's about, being able to tolerate move through it?
So, I've come to a position these days where I see myself helping the person to build scaffolding. Now we call in ISTDP we call that capacity building, right? So we help people to build resilience. I don't want somebody to personally. I've come to a view that I don't want people to be dependent on me as the person that makes things that holds some of the strength together here. So I'm essentially using mentalizing routines and capacity building routines to help a person to build scaffolding and resilience for themselves. And that, like, as you say, this is a really important part of a therapeutic process. And it's clearly something that hasn't happened for them earlier in life. And they're left with some sense of weakness and not being able to sustain the burden of the distress that they feel. So helping them build the internal scaffolding for themselves. Really important, very important. 90% of therapy, actually. For most people who've got some scaffolding with quite serious physical illness, we can do something within 6 to 10 to 18 sessions, right? Very easily. But if we need to build capacity and scaffolding and resilience to do that, that can double the length of a therapy. So half the therapy can be building the platform in terms of some structure on which you can do the work of that we would have done if they were better put together in the first place. So it's quite an interesting dynamic, that, I think. So,
it is, yeah. Look, do you think there's ways that people that are reluctant to go to a therapist or reluctant to actually do anything, how would they create that model for themselves, do you think? What would they do within their own lives to actually start the process, to give them the courage to actually go to someone? Because that's another issue. It's easier to go to the GP and ask for some medication rather than look inside, rather than do that mentalization.
It's a really tough one. And you know, I was talking to some colleagues last year, and we were talking about some research evaluation we were doing, and does a person need another person to turn the light on for them? And I just don't know about that. You know, I've run knowledgeable patient groups over the years, where we've basically done some psychoeducation, but we've really invited people to think about what they want to know that's going to help them. And one of the things that in the evaluation of that came out was that people started to say, well, I started to get curious about myself and why I was having these symptoms. So it wasn't so much the knowledge we gave them, it was that we scratched up something in them that said they started to ask questions for themselves. And I was fascinated by that. I've got some other colleagues who've taken that on and are doing some more work around that now in another part of the country. And I'll be interested to see what they come up with that. It's the same when I was working in the pain management clinic. We had a pain program which included some CBT therapists and some physiotherapists, and my job was really to do some of the initial psychoeducation along with the physiotherapists, and then to run some summary groups that we were running on how things were going. And again, the same thing we found in the research, that what happened is that people started to ask questions about A, what was causing my pain, and B, what could I do about it? These days we call that locus of control. Where is the locus of control? Is it in me, or is it in the doctor? Is it in my wife, or is it in the medication? And the sense that I might have some control and some power to change my life is a very complex thing. And I tend to think that it takes another person to kind of turn the light on sometimes to that kind of thing.
Yeah. Well, that's actually well said. You know, within this sort of chronic pain sort of community, there's a lot of self-help sort of options that are put out there, and many of the people find themselves quite frustrated because for some it works, like with Dr. Sarno's book, they got better straight away, and then other people have got earlier trauma, is how I would see it, but they then become quite frustrated with themselves and with the therapy that they're being offered. Can you sort of
so one of the things that's come out of our other research, where we're searching the mechanisms of change in ISTDP, and one of the things that's quite clear is that challenge within a particular framework makes a huge difference. It's a bit like the turning the light on, really. Can you turn the light on for yourself? It's hard to ask yourself hard questions. right?
Yeah.
It's difficult to say to yourself, I'm getting this wrong, without turning on the persecutory judge in your head, right? So it's knowing in therapy. I think one of the part of the art of ISTDP is being able to say to patients the hard things that they wouldn't say to themselves and other people wouldn't say to them, right? Like, why do you think it is that you're tortured by this pain? Why do you think it is that you're stuck with this anxiety? But in a way that doesn't persecute them and raise the criticism. So these are really,
that's the balancing act, isn't it?
Oh yeah, this is something I learned from Davlin, watching Davlin's tapes. Davlin was a master at saying really difficult things to patients that they took as gold,
Yeah.
And they took this as gold, and I find that with patients. Kernberg, you see, Otto Kernberg from the transference focused psychotherapy world, he's exactly the same. He says some outrageous things to patients. Things that, I mean, as a young therapist, I would have dived down a hole and covered myself in concrete for a few weeks before I came out, But he can do it from a position of compassion and concern for the patient.
Yeah.
And these are the moments that really make a difference to people,
They're the moments that count, really, aren't they? When the light goes on.
Yeah, they're the moments that count. Which is, I'm the same. I have people come to me who've been through 20 therapists, really nice therapists, very good therapists, but not kind of therapists that say very hard things to patients.
Well, even in our training, originally, a lot of people were very uncomfortable about being so direct about issues with patients, and they had to overcome. I think that's the beauty about supervision and videotaping patients, that you can actually get good criticism of your work and how you're moving the patient on. Yeah.
Well, that's right, absolutely. Well, in the beginning of my training, I was in psychoanalytic psychotherapy with the Tavistock, and in one of the main training organizations in London, we were told never challenge a patient and never ask a question. In therapy, your job is to interpret, right? Which is to make a statement on the basis of what you've heard, right? So, but never to challenge a patient and never to ask a question. So when I hear I spent 10 years of my career doing that, and then I found ISTDP, and eventually I learned that those weren't the best ways of doing it. So when you say to a patient, you hear the criticism going on, you say, why do you keep doing that to yourself? Now that's a challenge within a question, right? In ISTDP, it comes as part of it's in part of inquiry with pressure and challenge, right? We know how to classify it now, because Davin and Mallam gave us the tools to do that. These are really important things, and if people can say that to themselves, then they've got I have had patients who've written this on a piece of paper and stuck it under a fridge magnet. Why do you want to do that to yourself, right? That's a really important question for people. Why do you want to neglect yourself? Why do you want to criticize yourself? Why do you want to stir up guilt in your life? It is a really important question. Now we can give these people who come to us an answer on that, but the locus of control is outside of themselves. They can ask the question, they can mentalize. They know themselves better than we do, actually. Why do you want to do it? Why do you want to do that to yourself? It's so punishing for you, right? Now that's a really important question for people with pain.
Would you mention also, while you're on the subject, about the triangle of conflict and the triangle of persons, because we have a way of actually putting this together for patients so that they can actually see it in their lives. So
do you find that's useful all the time?
No,
you see the conflict. Where is the conflict on the triangle of conflict?
It's the interpersonal it's the what do you call it, now you've asked me a direct question, I've become anxious.
Yeah. Well,
See, there you are.
why are you criticising yourself, Rose?
Exactly.
The point is, I was at the Tavistock when Mallon was developing the triangle of conflict, right? It came out in the book in 1979, and he hadn't quite finished it. Now, the conflict is nowhere to be seen on the triangle of conflict, actually.
No, but it's within you.
It's under the triangle. Right?
Yes.
The triangle is the conflict is I have a drive, I have a want, but I repress it because there's another force. There's a conflict between that and a critic who comes in and says, you can't have what you want. You may want an ice cream, but you haven't been a good boy, so you can't have it. So the conflict sits under. The emotion from that is a subsidiary to the internal conflict, right? Now it's the emotion that starts to emerge into the world, and but then we get anxiety from that, right? Yeah. So the conflict sits under the triangle of conflict, and it's a conflict. But you see, Mallon originally called that corner drive and instinct. It became impulse, and it's become feeling in a lot of people's minds now. But it started its life as an I at the bottom there for instinct. And so the triangle of conflict is really the result of the conflict, not the conflict itself.
Exactly.
And that's why patients can sometimes get a bit locked up in it as a model of conflict, right? As though the conflict is between the emotion and the anxiety, or the emotion and the defense. But they're actually consequential. It's a consequential route, right? I want something, I can't have it, I repress the want, but there's an anger and a force that's coming up in here, but and that leads me to being anxious, and it leads me to a defense to reduce the anxiety, right? And all of this, like you say, becomes the pressure cooker. And the triangle of conflict is essentially the lid on the pressure cooker.
Yes.
Yeah? Is that right? Am I making sense? Yeah. So it's important that patients don't try and say that a feeling is in conflict with a defense and causes anxiety, or a feeling causes anxiety and brings a defense. A feeling never brings a anxiety, right? It's the conflict about the impulse. Yes.
Okay.
Yeah.
Can you say that again, please?
So
say it again.
A feeling never causes anxiety on its own. It never causes anxiety, and hence never leads to a defense, which is where the pain comes from, or physical symptoms. The feeling is a result of the conflict, emerging into consciousness, which causes the anxiety. The conflict is the feeling is a residual from the internal conflict.
Okay, so maybe use anger then to describe that again, so that the person, anyone watching, will actually see that the feeling is an emotion.
Anger is an emotion, and it's a result of being frustrated or whatever it is. But the conflict you see here is the real conflict is I want something or I don't want something. Yes. Right? And I'm being judged for wanting it or not wanting it.
By myself. And
by myself. Or I might believe other people doing it, and other people may be judging me for that as well. Right?
Yes.
This may be a compound, because essentially the child that I was talking about early in life, right? What they're developing through this optimal frustration is a way of dealing with their wants and desires and needs and instincts in relation to the world around them, right? So if I want a pay rise from my boss, and I go along and I say, I want you to give me an extra £20,000 a year, and he says no, I can't just whack him on the nose because he's frustrated me on that demand, right? I just can't expose my anger and whack him on the nose, right? So what I have to do is I have to go back to my office, pick up my squash kit, and meet my friend, and we have a game of squash, right? And that gets rid of the energy from the anger, right? We call that sublimation. That's the defense is sublimation. It's a reasonably healthy defense. I'm claiming I can use a healthy defense here, of course, which may not be the case, but that's my claim. I can use this. So we can sublimate the anger away, and that's a relatively healthy way of doing it. We all use these energy systems to do something, right? So we human beings have to mediate between our wants and our needs and our drives inside and the external world. And we develop laws for doing that, which may be more or less punitive for keeping these forces down, which don't add to a civilized society, right? So if I have some sexual feelings during the day, I can't just go out with my club after work and capture the next woman who comes along, right? This is just not acceptable in a civilized society, right? So we have to find ways of dealing with that, right? And we need the capacity to deal with this, which has hopefully been built up earlier in life to do that. You talked about the scaffolding to hold our instincts and things in place in healthy and civilized ways. But the conflict is not the anger itself is not the conflict. The anger isn't causing the conflict. It's the desire to do something which is frustrated by my boss, right? Yes. And the anger is a result of that frustration. He's frustrating me, and I'm feeling angry about that, right? So but the anger itself gets judged, right? Because it's like the conflict putting its head above the parapet with my anger, right? This is complicated, isn't it? This is complicated.
It is so complicated.
It changes the way we deal with patients if we remember that we're not just dealing with them. Emotions are never a problem, right?
That's right. It's the repression of them, isn't it? That's the problem.
No, it's not. It's how we deal with it. It's the conflict that the anger puts us in, and it's the conflict under the anger that pushes us forward with this amount of energy that drives the anxiety, right? So the anger may be the anger coming out in the outside world that we have a judge, a critic around who's going to criticize us for that. But really what they're doing is they're repressing the need that's been frustrated in the first place.
Yes.
Right. Yeah. If we just simply assume that that the anger is that it's guilt about the anger, then we've got a problem with this. It's the guilt about the needs and drives in the first place that are leading to the when we apply ourselves to the guilt about the anger, then we're starting to unravel the process with the conflict underneath it. Yeah.
Okay.
This makes a huge difference in therapy.
It does. It does.
Yeah.
And I think for the person who's experiencing the problem, it's so important, isn't it? Now, Laurie Ryder has asked us a question. I'll just put it up on the screen so everyone can see it. There. What if there are physical symptoms involved? How would you discover the conflict behind them?
Yeah, that's a really good question. Yeah. That's a really good question. How do we discover the internal conflict? Well, first of all, we have to work on why a conflict might not be coming out into the open. And we may be talking about things like, can I pay myself enough attention to observe the conflict without feeling that I might be exposed as a bad person? Or I might be exposed as a guilty person, like I've done something wrong. So these are really, how do we get to the conflict is in the relationship with a therapist, really. It's asking ourselves, what are the things that I really want for myself that I don't think I'm good enough to have, or that I'm going to get judged for asking for? right?
That I'm not worthy of or something.
I'm not worthy is the neglect, right? I'm a bad person. I'm not worthy of having this, right? That's and or have I? Is it a bad thing? Where's the law that says what I want is bad, right? And who's enforcing that on me? These are the kind of questions that it's worth asking ourselves when we're experiencing pain, because it's there that the anxiety starts to power in on us, right? That that we start to, it's our fear system again, right? We want something, we're energized for something that we want for ourselves, but we find ourselves in conflict with a sense that we're not good enough, or we're going to be criticized, and then that starts to generate frustration and anxiety. How does that sound, Laurie? Come back to us. What would you have an answer to that?
Well, what occurred to me was as you were talking, I thought, it's as if we don't deserve happiness.
Yeah. If I'm a bad person, I'm not worthy. Yeah, absolutely.
So I don't deserve happiness. Yeah.
And I deserve this pain.
Yeah. Okay, here we are. Let's take it over. Oh, I can't. Oh, there it is.
Okay. I'm not sure perfectly is a good one.
Here we are.
I'm not sure perfectly, Laurie. I'm going to get criticised and fail if I'm trying to be perfect. But there we are. So I gave up trying to be perfect a long time ago. Yeah. But thank you for pointing out that it may have some basis that's going to work somewhere or other. Yeah. Okay.
Is there anyone else out there that is dying to ask a question? Is it our hour is all, well, our hour is actually up.
Perfect for you. Okay, Laurie. It works for you. Good.
Good. Fantastic. Oh, good.
Thank
Dr.
you, Laurie.
Buller, thank you so much for being with us for this time. This program will also be on YouTube for anyone who wants to follow it up completely. It's the morning here in Australia, so I'll be around the computer for a few hours. So you're welcome to put any questions to me, or we can refer them to Dr. Buller. Could you just for a moment tell us how prominent it is to get, or easy it is to get, or difficult, should I say maybe, to get help in the United Kingdom for local people to you that are watching?
Yeah, so I don't think it's easy at all. I mean, I think there are some very good cognitive behavior therapists around, and who I work with, who have a degree of success with pain and the physical expression of physical symptoms, but the community of therapists generally is quite small. ISTDP therapy community in the UK is relatively small. It's quite difficult to find people who can work in this way. So it is reasonably difficult. There are some areas of the country. I had an inquiry a little while ago from somebody in Southampton looking for a therapist. It was difficult to find somebody who was willing to take on people with physical symptoms as something that they would be willing to work with. And so it can be really tough. Although I have to say that the services in general medicine here are improving dramatically. There's been a real focus on functional neurotic. What am I trying to say, Rose?
We've had Leo Russell on. We've had Leo Russell on.
That's right, Leo. Give us a hand. So functional neurological symptoms. So there's a big focus on what they call functional neurological symptoms and somatization now. And the government has put a lot of money into this. So we've got people like Leo Russell and others in the country who are making great strides in finding ways in which to steer services to being much more open to these kind of opportunities.
Well, there's an organisation in the UK called SERPA as well, isn't there? That
there is.
yes,
There is.
yeah.
Yes, which doesn't get enough publicity actually, but
No.
it's a great,
It's a resource,
great
isn't
job.
it? Yeah.
Yeah.
Yeah. Yeah.
Yeah.
Well, Stephen, thank you so much. It's the evening time in the UK, isn't it now? What is it, 10 o'clock
It
or
is.
something?
Yes, it is. It's dark now here. So.
Yeah.
Well, thanks for inviting me, Rose.
It's a
I
pleasure.
wasn't quite sure what to expect, but it's been great to have a dialogue with you and to push my thinking around. So, and thanks to Laurie as well for coming into that and make it a threesome. So that's been great. So thanks very much indeed. I'm sorry I've missed Tava.
What have you missed?
I missed your partner.
Oh, Tova, yes. Yeah, well, she's having a night off. Yeah.
Yeah, absolutely. Good for her.
Yeah. All right.
Okay.
Well, good night, everyone. Good night.
Yeah. Good night. Thank you.
Okay. We've stopped streaming.